Hey there, folks. KHOU reporter Melissa Correa joining you in the newsroom. We wanted to walk you through one of the stories that you'll see later today on the news, but we wanted to share the information with you now. And it's about the concerns related to e-cigarettes and vaping. We've seen a lot of chatter about this in headlines here at KHOU and across the country. And we're working with our partners in the Texas Medical Center. In fact, we just received some interesting information from Dr. Amy Arrington with Texas Children's Hospital and the Baylor College of Medicine. She actually sent out some questions to the Texas Children's Hospital community, asking doctors to look at these questions and ask them of their teen patients if they're concerned that vaping may be the cause of some of the medical concerns. And so we wanted to pop these questions up to you so you can see what Dr. Arrington is asking her colleagues to say. And she says, listen, begin with asking teens about a history of inhalation drug use, specifically with electronic devices. And that's because we've heard of teens using e-cigarettes to vape either nicotine or THC, which is basically marijuana. She also wants doctors to ask their patients about the frequency of use, specifically, are they smoking THC, and if possible, how they got the device, how they use the device, the brand name of it, and if they've modified that vape pen in any way. She's also asking doctors at Texas Children's Hospital to get information like, where did the teen purchase the vape pen? And I think this is because what we're hearing from the FDA and CDC is like a lot of mystery surrounding e-cigarettes and vape pens, especially with this massive spark of teens either becoming really sick or, worst case scenario, losing their life from some sort of connection with this electronic cigarette. Okay, and she says, be aware that the illness can worsen over time, and some suspect cases have required high-level intensive care and respiratory support, which leads us to this next slide that we created with you, or created for you with the help of these doctors, which are the symptoms that may be linked to vaping. And listen to this. It could be something as simple as coughing, shortness of breath, chest pain, and fatigue. She also wrote to doctors that many patients also experience significant GI symptoms like nausea, vomiting, diarrhea, and weight loss. She also said that a lot of these patients that have had a history of vaping will be diagnosed with atypical pneumonia. And she said all patients have reported using e-cigarette products, and the symptom onset has ranged from a few days to several weeks after that e-cigarette use. And while THC has been reported in a majority of patients, not all of them. No single substance or e-cigarette product has been consistently associated with any of these patients. And this is what she's asking doctors at various Texas Children's Hospital locations to be on the lookout for. You know, if you're seeing patients come in, self-report with some of these symptoms, you gotta ask them about the vaping. And the interesting thing, we've included the link below in this article, is that the Baylor College of Medicine just released research study in which they tested the health effects of vaping on 4 different groups of mice. I'd encourage you to click on that link. This is one of the latest research studies surrounding the health effects of vaping, which may be used by the FDA and CDC to better get a handle on what this is doing to our bodies. Of course, look for more coverage. We'll have more from Dr. Arrington on KHOU later today.